So this is going to be a mini lesson about implementation science. So what is an intervention? This is a word that we use a lot in clinical or health research. And basically it is that there's a health problem. So someone has asthma. Okay, and asthma is a medical problem where you have more trouble breathing because your airways get tighter, so they get kind of more narrow and it's harder for the air to go in and out. So an intervention is basically something we can do to make that better. Literally, that's all it is. It's something that we can do. So it can be medication, it can be a therapy, it can be a device, it can be different things that we do to make a health problem better. And so the example for asthma is that there's something called a spacer. Some of you might not know what that is, but a spacer is basically like a tube that you put next to the medicine that you get for asthma. The medicine you get for asthma is not a pill that you swallow. It has to actually get down deep into your lungs. And so it comes as an aerosol, kind of like if you had hairspray, you're spraying it, you're trying to make it small and get all over your hair. Instead of just one little spot, right? And so the aerosol tries to use this propellant, which basically the pressure in the little tube and the chemical that's in there, the propellant, makes it kind of pushes it in. But it does it very quickly. And so sometimes when people are trying to take a breath with their medicine, then the medicine gets just in their mouth or in the back of their throat, and then it doesn't make it down to their lungs. So spacer kind of slows down that process, and it's a tube that holds medicine in there so someone can really take deep breaths and get it down. And so what studies show is that intervention, that spacer, that tube, helps people with asthma get their medicine better and have improved breathing faster. So you might think of, okay, if the health behavior is that someone is using a spacer and the spacer is the intervention, if you just make it available, are people just going to use it? There's lots of reasons why someone might not use it. They might not know about it, and their doctor might have so many things to do that they forget, and they don't have time to tell the patient about it. And let's say the doctor tells the patient about it when they come in, and then they just say, I'm not going to get it. They just don't go. They don't go to pick up the spacer for whatever reason. Maybe they don't want it. They're like, I don't feel like getting that. Like, I don't need it. They might not think it's important. They might think, I'm fine with the medicine the way that it is. I don't need this thing. It's like an extra kind of bulky thing to have to carry around with me. It's too expensive maybe for them. So people have different ways of paying for their health interventions, and their insurance might not cover it, or maybe they lost one and now they can't get a second one. The pharmacy they go to, they might not have it. They might say, oh, we're out of stock, we don't carry that anymore. The parent might think it's important because this is like a kid, but maybe the patient doesn't like it. So the parent might get it, and then the patient doesn't actually use it. And they might feel like it's embarrassing because it's more noticeable than just like a regular spacer. So more people will see that this person has some kind of health problem, and they might feel embarrassed. And so next thing we're going to talk about is an implementation strategy. So an implementation strategy is really something that you do to try to help people use the intervention you made. So we have this spacer, but you can see there's all sorts of reasons why someone might not use it. And an implementation strategy is basically something we do to kind of make sure people can use it more easily. Okay? And so there might be, for example, a doctor who knows their patients should use spacers, but knows maybe that there's a problem with them getting it at the pharmacy, getting the education, the parent and the kid kind of figuring how to use it. So their strategy might be that there's a pharmacy next door that has the spacers always available, that the doctor gives them like a quick prescription and says, hey, you just walk over to this pharmacy, they'll give it to you for free and they'll teach you how to use it, and they always have them available. Maybe that solves some of the problems that you had. So this means really that the work in research of just doing a study and showing that it works, the intervention, the actual like health change you want to make works, and then doing what we talked about, publishing it in a journal so that it's documented there and other people can find out about it. But that's actually not enough for it to actually make a difference in people's health. Because if it just sits in this journal and that's it, then what was the point, right? And so there are basically this whole area called implementation research is like, how do we get people to actually use the things that we've studied and know work? Okay, so on the very left, you can see this is this Proctor model. It's another one of these models with arrows going from different boxes. On this leftmost box, it says intervention. So the intervention in this example is like that spacer. And so we've shown that there's evidence for that. And we know that it works. And right now it's just sitting in a journal where someone can read about it and decide if they want it or not. And a doctor can just try to remember to prescribe it, and a pharmacy can just try to remember to have it. But the next step is, what are implementation strategies? So these are kind of examples at different levels. So it could be that there's an individual level, meaning that patients get education about using a spacer, and the providers get education, and then they kind of do something together. There can be like group learning, so it can be at a group level, it can be at an organization level, so like the whole hospital system learns about this and kind of makes it so that people can easily get the spacer, and that's kind of that pharmacy provider example. So there's kind of different levels you could intervene at, smaller and bigger. And then what you do is you measure, does this actually get used, basically? And so you have these implementation outcomes, like feasibility is, can we do it? Can we do this like provider pharmacy relationship? Fidelity is like, do they stick to the plan? Penetration is like, does it reach everyone, or does it only reach specific types of people? Like only people with really bad asthma get it, but everyone else doesn't. Is it acceptable? Can people keep doing it after they've started it? And how much does it cost? Does it spread to other places? So it's like, those are all different things that we measure, or we can measure after we already know that it works, but we don't know, does it work in the real world, meaning are people actually going to use it? Okay. And then you kind of continue to measure these service outcomes, which are, does it make a difference in people's health? And client outcomes are, do people like it? Are people happy with it? And that's it about implementation science mini lesson.